I thank the Chairwoman Miller Meeks and Ranking Member Brownlee and distinguished members of this subcommittee. I want to thank you for considering my bill, H.R. 9324, the Protecting Veteran Access to Telemedicine Services Act of 2024. I'd also like to express my sincere gratitude for allowing me to speak in support of this legislation today. This bill seeks to ensure that our nation's veterans, whether they reside in bustling urban centers or in the most remote areas of our country, have uninterrupted access to the health care services they need and deserve. As you're aware, the Ryan Haight Online Pharmacy Consumer Protection Act was enacted in 2008 to regulate the prescription of controlled substances via telemedicine in response to the rise in online pharmacies and the potential for misuse. This law plays an important role safeguarding public health, but also has not been updated to reflect the differences between 2024 compared to 2008 and does not acknowledge the difference between VA and general civilian online pharmacies. During the COVID-19 pandemic, requirements under the Ryan Haight Act for a patient to meet with a practitioner in person for the prescription of a controlled substance were temporarily waived. The DEA and HHS announced a temporary extension of these flexibilities, but that extension expires at the end of this year. My bill, the Protecting Veteran Access to Telemedicine Services Act of 2024, would permanently extend this exemption to allow healthcare professionals employed by the VA to prescribe medically necessary controlled substances to veterans via telemedicine under certain conditions. This exemption has been a lifeline for our nation's veterans, and without a permanent exemption, many veterans could see their access to vital health care services severely restricted. For our veterans in urban areas, the expiration of this exemption would mean longer wait times for in-person appointments, further straining an already burdened VA healthcare system. The situation is even more critical for veterans in rural areas. These veterans face unique challenges, including geographical isolation and limited access to healthcare providers. The Ryan Haight Act exemption has enabled them to receive care from VA providers and specialists who may be hundreds of miles away without the need for costly and time-consuming travel. The continuation of this exemption is not just a matter of convenience, it's a matter of necessity. It ensures that veterans in every corner of this country have equal access to the care they so desperately need and they deserve. It's an honor to speak in support of my legislation today. I urge my colleagues on this subcommittee to support the bill, to act swiftly in passing this legislation. Our nation's veterans have sacrificed so much for our freedom. It's our duty to ensure they receive the care they've earned in a manner that meets their needs in today's world. And with that, Madam Chairwoman, I yield back my time.